ನಮಸ್ಕಾರ. ನಾನು ಕನಕಪುರದಿಂದ ಬಂದಿರೋದು. ನನ್ನ ಹೆಸರು ವಸಂತ ಲಕ್ಷ್ಮಿಯಿಂದ. 2011ನೇ ಇಸ್ವಿಯಿಂದ ನನಗೆ ನೋವಿತ್ತು. ಹಾಗೂ ಈಗ ಮೇಂಟೈನ್ ಮಾಡ್ತಾಯಿದ್ದೆ. ಆಮೇಲೆ ನಮ್ಮ ತಂಗಿ ಸಜೆಷನ್ ಮಾಡಿದ್ಲು, ಈ ನಾರಾಯಣ ಹೃದಯದಲ್ಲಿ ಪ್ರಶಾಂತ್ ಅನ್ನೋ ಡಾಕ್ಟ್ರು ಚೆನ್ನಾಗಿ ಮಾಡ್ತಾರೆ ಸರ್ಜರಿ, ಅಲ್ಲಿ ಹೋಗಿ ತೋರಿಸು ಅಂತ. ಒಂದು 2-3 ಜನ ಪೇಷಂಟ್ ಇಲ್ಲಿ ಮಾಡಿಸ್ಕೊಂಡಿದ್ದರು, ಅವ್ರ ಹತ್ರ ಅನುಭವ ಹೇಳಿದ್ರಂತೆ. ಹಾಗಾಗಿ ನಾನು ಇಲ್ಲೇ ಬಂದು ಅದೇ ಡಾಕ್ಟ್ರನ್ನ ಮೀಟ್ ಮಾಡಿ ತೋರಿಸಿದೆ. ಆಪ್ರೇಷನ್ ಮಾಡಿದ್ವಿ. 3 ದಿನಕ್ಕೇ ವಾಕ್ ಮಾಡೋದಕ್ಕೆ 5ನೇ ದಿನಕ್ಕೆ ಡಿಸ್ಚಾರ್ಜ್ ಮಾಡಿದ್ರು. 3 ವಾರ ಆದ ತಕ್ಷಣ ನಾನು ವಾಕರೆಲ್ಲ ಬಿಟ್ಟು ಸ್ಟಿಕ್ಕರೆಲ್ಲ ಬಿಟ್ಟು ಕಾಲ್ನಡಿಗೆಲ್ಲೇ ನಡೆಯೋಕ್ಕೆ ಶುರು ಮಾಡಿದೆ. ಒಂದು 2 ವಾರ ಪೇಯ್ನ್ ಇತ್ತು. ಈಗ ಏನು ಪೇಯ್ನ್ ಇಲ್ಲ, ಆರಾಮಾಗಿದ್ದೀನಿ. 2 ಕಾಲು ನೋವಿತ್ತು. 2 ಕಾಲು ಒಂದೇ ದಿನ ಆಪ್ರೇಷನ್ ಮಾಡಿದ್ರು. ನನಗೆ ರೋಬೋಟಿಕ್ ಆಪ್ರೇಷನ್ ಆಗೋದ್ರಿಂದ ನನಗೆ ತುಂಬಾ ಚೆನ್ನಾಗಿ ಬೇಗ ಕ್ಯೂರ್ ಆಗೋಗಿದೆ. ಯಾವುದೂ ತೊಂದರೆ ಇಲ್ಲ. ಈಗ ಆರಾಮಾಗಿ ವಾಕ್ ಮಾಡ್ತಾಯಿದ್ದೀನಿ. ಇನ್ನೊಂದು 3 ವಾರ ಬಿಟ್ಟು ನೀವು ಯೋಗವೆಲ್ಲ ಹೋಗಿ ನೀವು ಮಾಮೂಲಿ ದಿನಚರಣೆಗಳೆಲ್ಲ ನಡೆಸಿ ಅಂತ ಹೇಳಿದ್ದಾರೆ, ಧೈರ್ಯ ಹೇಳಿದ್ದಾರೆ. ತುಂಬ ಧನ್ಯವಾದಗಳು ಡಾಕ್ಟ್ರಿಗೆ, ಈ ಆಸ್ಪತ್ರೆಗೆ. ತುಂಬ ಚೆನ್ನಾಗಿ ಕೇರ್ ತಗೊಂಡು ನೋಡಿ ನಮಗೆ ತುಂಬ ಅನುಕೂಲ ಮಾಡಿಕೊಟ್ಟಿದ್ದಾರೆ.
Today I want to discuss about one interesting lady, Vasantha Lakshmi. She is from Kanakpura. She is having bilateral knee pain, suffering for last 10 years. She is very interesting because with that knee pain, to good extent, she was doing yoga activity, so her muscle strength were good, and she wanted to get rid of this knee pain. She was slightly handicapped because of the knee issues. Then when I explained about the replacement surgery and I showed the results of the patients, and when I discussed about robotic surgeries, she was very interested in getting in the surgery. We had executed a robotic knee replacement, both the knees together in her. The advantage in robotic surgery is it is very precise and it is very patient specific. Patient specific in the sense I can see what is her deformity. With the CT scan pre-hand, I can adjust the implant according to the deformity. I can pre-operatively see where are the extra bone which need to be removed and what is the balancing which is best for her. That I can decide with the robo before I place the implant inside. So in that way, this is very extra advantage compared to the conventional surgical procedure. So we executed the surgery, which was very successful, and post-operatively patient was very comfortable. Routinely we used too much of pain medication. She was comfortably doing activity without much of pain medication. Normally post-TKR, patient will take some time to recover, go to their washroom and doing activities that she would do earlier. She has done earlier. That's why she was comfortable getting discharged on the 5th day post surgery, and she is coming 3 weeks post surgery where she is comfortably walking without any support. She is very happy with the surgery. Basically the robotic surgery makes the pain very less because the amount of soft tissue dissection to see things are not there, and the amount of manipulation, handling of osteophytes, handling of bone are very less. Since the tissue handling is less, the amount of damage done is less, amount of pain generated is less, the chance of infections are also very less. Since our numbers, our experience is happening in robotic surgery, our surgical timing, surgical speed with which it goes is picking up. That helps in reducing our infection as well. Thank you.